Okay. Hello and welcome to Career Cloud,
Hello,
given
hello.
by Give Specific. And my name is Gena Nicole, and I am here with Dr. Oparah today. How you doing, Dr. Oparah?
I'm doing great, Gina. How about yourself?
I am great, and we are good friends all the way back wow, maybe 15 years now.
Yes,
So
Mercer undergrad.
that's right, from Mercer University. So I am so happy to be sitting with you again. And we've so much time has passed by, and we've all gone on our different journeys, but you have accomplished quite a bit in your life. So let me introduce the people watching to who you are, okay?
Okay.
Dr. Okenna Oparah is a first-generation immigrant from Nigeria. Watching his parents navigate their path from penniless to middle class gifted him with a passion for the value of education and personal finance. Growing up without a lot of money instilled him with an appreciation for the power of self-discipline, planning, and entrepreneurship. Okenna received his doctorate in pharmacy from Mercer University and, and found after graduating that building a career is significantly different from building a GPA. Don't we know it? He wrote an ebook called
Oh, we know it.
Escaping Retail, a quick and dirty guide for pharmacists who want to grow past retail. This helps pharmacists who are navigating their own careers. He offers pharmacy-specific information at www.escapingretail.com. And we're going to make sure that we post that for you on the link below. Okenna is currently working on creating a personal finance and student loan consulting curriculum that he can share to empower people who are interested in their self-actualization. Okenna and his now wife, Lakeisha Joyner, have a heart for sharing the power of budgeting, financial literacy, and self-improvement with their communities. And congratulations is owed to you and your wife. Congratulations, married
Thank you
sir.
so much. Thank you.
You're welcome.
She
Welcome
made
to
me an
married
honest
life.
man.
What'd you say?
That's right. That's right. I say, well, I'll just say she made me an honest man. She's
There
made me
you go. Good woman. Good woman she is.
right.
It's a good world, let me tell you. The married life is a good world.
I'm
Well,
excited.
let's dive into everything that you have to tell me about the life of being a pharmacist.
Okay.
What does that mean? What do you do?
Okay. Well, so just to set the stage, I am a clinical inpatient pharmacist. Um, and I also have some roles that relate to kind of administration and coordination of a government program, but we'll put that aside and we'll focus in on the clinical inpatient pharmacist kind of life. So what that means is I am not the pharmacist that you see at Walgreens, although I have had those roles in the past. I am working inside of a hospital and seeing patients in conjunction with doctors and nurses. And so I'm helping with drug regimens. I'm helping doctors to monitor therapies and make sure that we're not overdosing or underdosing anybody. Monitoring things like adverse effects of medications, educating patients about their medications, and just ensuring that everything having to do with a patient's medications is handled appropriately and adjusted to that specific patient's renal function, liver function, etc. So that's kind of the broad overview of a description of my responsibilities as an inpatient pharmacist.
Okay, great. And I'm glad that you are in that particular field and in that particular avenue because, like you said, I think many people, when they think of pharmacists, they think of the person behind the counter in the white coat who gives them their drugs or medication, and usually in a retail setting. But that doesn't always have to be the case, does it?
Not at all, not at all. Although that is a great majority, I want to say maybe like 70% of pharmacists, 80% of pharmacists, and most pharmacists actually start out in the retail setting. There are a wide variety of roles that are not related to kind of that retail setting. And so I think understanding that kind of gives people who may, you may have a narrow view of the pharmacy world or the possibilities there, but there are a million, different career paths that you can kind of go down and find something interesting to do that doesn't involve maybe dealing with, the retail setting or dealing, face to face with patients.
Okay, great. Now, can you tell me, compare it just a little bit? Not, I don't want to spoil your book for anybody, but
Yeah.
just compare and contrast a little bit of your personal experience and in terms of the pros and cons and what you liked or did not like because you've been in the world of retail
Yeah.
and versus the clinical field that you're in now. What are
Right.
some of the things that you really enjoyed in the retail life, and what are some of the things that made you say, I need to do what I love in a different way?
Gotcha. Oh yeah. So okay. So yeah, retail is a different beast from clinical. And I'll start with the things I enjoyed. So what I did like about retail was the opportunity to talk with people, to meet people, to, you're there every day in the pharmacy. So you start to, you kind of gain this community of people that you're seeing month in and month out. And getting to know, their medications, their lives. Oftentimes, some of the older folks will come by the pharmacy and just want to tell you about their day, or stop by with something sweet, maybe some cookies, or you become part of the community. So
Mhm.
that is really, really, really cool. And I really enjoyed meeting people, being in the community, and helping, educate, being, because I think, I forget, 90% of the world, or 90% of America, or some very high percentage of people live within, 15 minutes of some type of pharmacy, right? So pharmacists are often kind of the, frontline, um, medical source of medical information, maybe a place where people can go to consult before they go to the doctor, to see, is this something serious, which can be, weird in its own way. When somebody pulls up at the counter and pulls up their shirt and like, is this normal? And you're like, it can get kind of interesting. So that I did like. The downsides are retail is unfortunately a business, right? So there are metrics and standards and things that may sometimes get in the way of you practicing a strictly healthcare professional role, right? So at the end of the day, no matter what company you work for, they have certain financial metrics that they want you to hit, right? So that may mean they want you to give a certain number of flu shots. They may want you to be able to, work a heavy caseload or heavy patient load with maybe a low number of technicians or help. So that leads to things like burnout, or you feeling overwhelmed, or having 3 phones ringing and not enough people to help you kind of answer the drive-through and all that, and then somebody waiting for a flu shot. So those situations can turn into just you feeling kind of stretched beyond your means, stretched and not given enough help. That bottom line becomes a driving factor in some decisions, and that's not a great place to be often. You don't want to be stuck kind of between the bottom line and the patient care. So that was one of the reasons that I decided to move or try to shift away from retail to a place where at the end of the day, my main concern was taking care of patients, and figuring out ways that I could do that better versus figuring out ways that I could squeeze out a little bit extra, profit margin. So those are probably the biggest driver for my shift away from retail. And on the inpatient side, you get a little bit less patient care. So you face-to-face patient interaction. You may not be, the very first person or the most, intense kind of patient contact, because that's usually the nurse in the hospital. The nurse is the one seeing the patient day in and day out, and kind of throughout the day. But for me, that worked quite well. I was able to go in to see the patient and talk to people and get to know people. But at the same time, I was able to go back to my computer, go back to my office, and figure out ways that I could kind of help them behind the scenes. So the kind of mixture of those two things was perfect for me. Being able to see people, but not see too much of people. Nobody pulls up to my office and lifts their shirt up. So
Right.
I definitely, enjoy that about the inpatient pharmacy or clinical pharmacy side.
And you know what you're saying is very very real, because I've heard plenty of stories from relatives who have worked in pharmacies, and you know, you do get to know people and they become quite comfortable with you. And I'm telling you, the stories are hilarious and sometimes sad of the expectations from the pharmacist who is maybe asking to do something that's out of their line of business. So.
Exactly. Mhm.
Yeah, well, that's a great description that you gave, and you also made it very clear as to why you feel like you're maybe in the right fit for you now in terms of what you're doing in the world of pharmacy. So my next question is, if you could think back in the last 5 years,
Yeah.
what new belief or behavior or habit most influenced your life? Because I know you said that in that retail world, it was very stressful. And so you had to create some type of coping mechanisms to continue to do your job and to do it successfully. And you also had to have a lot of courage to kind of take that leap and say, I'm going to continue this career path in a different way, even though I'm unfamiliar with it and it might be kind of scary. I'm going to do something different. But, you know, people usually don't do that and make those moves unless they have developed habits to ensure that they're going to be successful when they take that leap. So tell me some of the habits that you have and that you incorporate into your life to be a successful pharmacist.
So yes, great question. I think probably the biggest, you asked about a little bit about belief, behavior, or habit that's kind of improved. The biggest belief I think that was helpful to me in my career period, but specifically like when making that transition from retail to clinical and going back and doing the residency, was having a growth mindset, you know, and figuring out things that kind of go along with that. One of which is that nobody has all the answers, nobody's perfect, and that hard work is usually the secret ingredient. And if one person has accomplished it, then it's possible for anybody else, you know, by and large. So those kind of three things, and they all kind of work together, were kind of the big secrets for me. That growth mindset is so important. I think when we're younger, or maybe when I was younger, I just had this, you know, we see so many of these kind of young geniuses, or like, you know, we see Mark Zuckerbergs or people who
Mhm.
are in college and they just have it, right? They're just geniuses, you know, they can go out and code or do it or start a company, um, and that's great for them. But I think for the great majority of the rest of us, like there's still hope and excitement. Like there's still room for us to grow, and room for us to become what we want to become. It may not happen when we're 20, you know what I mean, or 15, or, you know, we may not make $1 million by the time we're 22, but the possibilities for an amazing life is still there. It's just going to require hard work, right? And this you know, belief that if I continue at it, if I work at it, uh, uh, it can become my life or my reality. I can accomplish something amazing as long as I continue to work at it. And it may not be as easy as somebody who, you know, whoever else, but it's still possible for me. And I think that was the big kind of big driver for me. Was I've also had this, or I have started to grow around that time into this belief that, so just to kind of give you a little background, and then I'll kind of wrap up this question because I could get long-winded. But when I was in retail, usually when you're in retail, it's kind of hard to move into a clinical position. They tend to, some people see that you're in retail and they go, oh, well, maybe they've forgotten some of their clinical skills from school, and we don't want to hire somebody who's forgotten that, when we have residents coming out of a residency program who maybe be a little bit more, you know, already trained.
Mhm.
So you had to believe that, you know, even though I didn't get a residency straight out of school, I was able to go back, and that there was still a possibility there for me, you know. So, you know, kind of making that leap required just that thought of, you know, this is possible for me, even if it didn't happen like when I thought it should happen, you know. And that persistence, and that, you know, trying again and figuring out what you did wrong, and look and, you know, strategizing, looking at the things you did previously, and then figuring out ways that you can fix your shortcomings. And so, you know, just being persistent and having the right attitude, and figuring out what you did wrong so that you can, you know, do a better job the second time or the third time, however long it takes you to kind of get to the goal that you're reaching for.
Great answer. And I think you really kind of hit on what my next question was going to be in terms of advice to give to people who are looking to enter into the field. And I thought what you said was so important, because not only do we have people who follow us on Career Cloud who are young people, maybe straight out of college, or even high school students who are looking to follow their dream and pursue their passion in the world of pharmacy, but you also have career changers who are saying, I want to do something else, and I want to do something different. And I know they're always thinking about, well, is this industry saturated? Is there room for me?
Right.
And I think what you said about being persistent and saying, hey, I'm still going to try to go into this avenue, even though I didn't start out here, doesn't matter how old I am. I think that's really important, especially now considering the climate of our world. People are kind of thinking again about what they want to do with their life and the rest of their life, and they might be wanting to go into pharmacy. And I think what you said was really encouraging. So that's awesome. So let's get a little bit more into giving that advice in your book. So don't give us the book, because we want people to really support and to really read Dr. Oparah's book, okay? But I do want you to kind of give us a little bit of some advice that you would give for the person who is maybe in the world already. Like what did you do specifically? Because you said, you had to be persistent and you had to have the belief, but people also want some tactical and practical steps of, okay, what do I really need to do? Do I need to beef up my resume? Is there anything that you can give that person that's just, black and white practical of, this is what you need to do and this is what you don't need to do in order to go into my field? So they
Sure.
can kind of be prepared for that.
Sure. So I think there's a couple more than one way to skin a cat, right? And so if you're in the retail setting, or let's say you're, let's say where you're in a retail setting, and you're wanting to move away from it. I think there's a couple different ways to kind of go about it. One of the big easier ways is to get into a residency or apply for a residency, get into it. And that will kind of pave your way in a large part, because you'll be in the hospital setting, you'll be gaining experience, and that's something you have on your resume, and that just kind of gives you a rubber stamp, letting other employers know, other hospitals know that this person has experience that is relevant to our setting. So that's one way. The other way is just requires a little bit more legwork, right? Which is something I always recommend, is finding places that need your help, and that can be smaller hospitals, right? So something that I think is kind of is just that's not underutilized. It's underutilized is volunteering or applying for another position inside of a organization that is growing or smaller, and could use your skills, right? So even if you don't have any hospital experience, finding a smaller regional hospital, places where people aren't in a rush to go, which sounds terrible, but if you have a smaller town with a smaller hospital, they probably have a need for some of your skills. There's some skill that you have that they could probably use, right? So a lot of hospitals, some smaller places may have budget shortfalls, or they're not able to hire for every possible job that there is. So you may have pharmacists there that are doing 3 or 4 jobs more than what they're able to do. So if you're able to volunteer, or find ways to get in contact with these smaller hospital administration, and then figure out what do they need help with, right? How can you put yourself on their radar? And then once you're in that ecosystem, to me, then you kind of can create your own residency, right? So if you're, all a residency is just like an internship or something, is you're in different departments learning different things that relate to the running of the pharmacy department or you're treating patients. So you could just basically take a look at any residency's like curriculum, and then figure out, hey, they're spending 8 weeks in a NICU, they're spending 8 weeks in the ICU. Get a job at a smaller hospital and say, hey, is it fine if I shadow you for 8 weeks, or come in, 4 hours and help you out? I'll figure out how to process patients with you, and then I'll be an extra set of hands. And you may not, it's just figuring out how you can be, I guess, helpful to these organizations, or to get to the place that you want. And moving into a smaller hospital then also becomes something on your resume that you can use as a launching pad to a bigger, or just another role somewhere else. So you stay at a hospital for a year, working in some function. People at least know, oh, he's got some hospital experience, and it's not the same as somebody coming from like a Walgreens after 10 years. It just has a different look, and so they also will know that, hey, he's a self-starter or she's a self-starter. She can figure out a creative way to attack a problem and get to the outcome that she or he wants. So those are some of my biggest kind of like tactical tips. Other things are networking, and that's I think huge. Of course, we all have heard the saying, it's all in who you know, or I don't think it's all in who you know, but I think it can definitely grease those wheels a good bit. Going outside of your way to attend organizations that are specific to the place that you want to go. In pharmacy, there's things like American or the Association for Hospital Pharmacists, things, and then lower than that are your regional, so state specific. There's a Georgia Society for Hospital Pharmacists and things like that. And volunteering there, or figuring out ways to join those organizations and meet people, and then becoming an officer or something in those organizations. And now they know that not only are you a member, but you're able to you're donating your time, you're doing things that are pushing the organization forward, and then people are able to see, oh, he's just effective, or he or she is effective and consistent, and I can trust that when they say they're going to do something, they do it. And so when the opportunity comes up, that your name, if you let your intention be, no, hey, I would love to move to a health system setting. If you ever have an opportunity, think of me. And over time, as all these opportunities crop up, they're like, well, this is something that maybe this person would be interested in, and that's how these things kind of work. So that's the other thing, the kind of the practical tactical tips I would give anybody kind of looking to make a transition.
And what I liked about everything that you said that people may not like is that most of the suggestions that you gave, you weren't getting paid.
Right. Absolutely no money involved.
Now, you don't have to reveal how much you make, Dr. Oparah, but we could say that you're comfortable, correct?
I would say so, yes, ma'am.
Right. So, you can look up if you're not familiar with what pharmacists make, new pharmacists and veteran pharmacists, if you will, and it's a pretty nice salary. But all of the things that you mentioned really dealt with the passion and the persistence in pursuing that passion, even if you're not going to see the reward immediately, which is really important for people to understand when they're trying to pursue something, that it's not going to happen tomorrow. It may take some time, and you may not see that reward for a while, but when it comes, it's pretty nice, isn't it?
I would say so. Yes,
okay. Ma'am. Well, that is great. And you gave some really good tips. I know if I were interested in going into the world of pharmacy, I would find all this information very, very beneficial, because some of the things that you said, even by people researching the curriculum of residency programs and getting the experience that way, and knowing how to network and knowing the importance of networking and volunteering, I think it's important that we still hear from professionals and successful people that means something in today, in 2020. It still means something to give up your time and your talents to your craft. So that's awesome. That's awesome. So we at Give Specific and Career Cloud are readers, and we know that you have your book that I want you to give a shameless plug for over and over again. We're definitely going to put all the information below, but also we want to know, give us one or two books that has really influenced you as a person, or has really had a huge impact on you in your profession.
Okay. So I will start with kind of my go-to, which is, it's going to sound cliche, but the Bible. Definitely been a huge, guiding light, especially as I get older and life gets more complicated. It's good to have kind of a a signpost or a guidepost on like how to operate, how should I be treating my work, how should I be treating other people, etc. So that's a kind of a gimme one. The other two, I thought about this. So the ones that have kind of hit me, these aren't necessarily specific to my profession, but they are ones that kind of had a big influence on me. One is a book called Your Money or Your Life by Vicki Robbins and Joe Dominguez. And so this book talks about just kind of jobs in general and what money actually is, right? So money, and I'm not gonna give away the whole book, but the money is basically, we're trading in our life or time in exchange for money, and oftentimes, right? So, the goal is generally in capitalist societies is to make your time as valuable as possible so that you can get as much money in return for your time that you've given up. And then it helped me to kind of come up with a framework of, if my time is this valuable, when I buy something, I'm trading in, instead of just dollars, I'm trading in 30 minutes of my life or an hour of my life, and really making you value, is this thing that I'm buying worth this time that I've given up, And then it just kind of helps you put a lot of things in perspective, like, how do I want to be investing my time, because time really is your money, right? And how do I, what do I want my future to look like? Do I want more time with my family? Do I want to be working for the rest of my life? All these different questions, right? So this book was just a huge kind of helped me to put like money into a good framework.
And what was that book again? Give me the name and the author.
Sure, it's called Your Money or Your Life.
Your Money or Your Life.
Yeah, by Vicki Robbins and Joe Dominguez.
Okay.
A similar one was something called Total Money Makeover by Dave Ramsey, and that's just a book that kind of helps me figure out what I was saving for and kind of, give me like step-by-step process for kind of moving towards financial freedom. And I think those are probably the three. There's the other books, a lot of them have been about like productivity and like aiming yourself at the right thing. So things like The 4-Hour Workweek by Tim Ferriss, Keith Ferrazzi, Never Eat Alone. It just talks about networking. There's a good number of books, but those are probably some of the big heavy hitters that kind of, I know kind of shifted the way I thought. So yeah, those would be my book. And of course, my book, which I enjoy. But just this quick plug, and it's just to me, it's a guide to kind of help. And it was really aimed at people who didn't get that information. So oftentimes, I'm a first-generation immigrant. My parents are not familiar with the system in America, or how things work, or how the schools work, or how loans work, or things you should be thinking about. And it's kind of like that. It's trying to be that mentor that maybe I didn't have, and giving you food for thought to help those of us early in our careers, but who maybe didn't have a mom or dad in corporate America who could say, hey, this is things you should be doing now. These are thoughts that you should be thinking now. This is things you should be planning for. So, yeah.
Well, I am so excited about it. And of all the books that you listed, I can speak to 3 of them and tell you that they are wonderful books. And a couple of them I'm going to have to read because I'm excited about reading it for my own personal growth and development. And I think, I'm not going to speak for everyone, but I think those of us who are not immigrants to the United States can definitely say that, man, we wish that we would have had some type of mentor or guide book to help us navigate through the systems in our career fields and just the system of life. So I am excited for you, Dr. Oparah, and your book. And I'm excited for everything that you're doing. And it was just really great. I think that people are getting a lot out of it.
I'm excited. I'm hoping people do. And I've really enjoyed it as well. Thank you, Gena. This has been amazing.
Yeah, well, thank you for being a guest, and thank you for giving us so much guidance and wisdom. And I want to make sure that those of you who are watching continue to keep up with Career Cloud, following and subscribing to Give Specific on Instagram, Facebook, and YouTube. And also look forward to making sure that you become a Patreon member for us, so you can really keep up with what we're doing and who we're interviewing, because I'm telling you, we're giving you guys some insider secrets, if you will, of these professions in these career fields that I really think are going to do nothing but benefit you. We're not taking anything away. So I'm not going to take up any more of your time. I thank you, and I wish you the best of luck and success, my friend and my brother of for a long time, over 10 years now, 15 years, maybe 20.
Right.
I don't know. I don't want to give my age up. I don't
All
want to
right,
give your
right, right.
age up.
We can't let them know that. We can't
We
let them
can't
know
let
that.
them know. We're still cool in our own right,
That's right. That's
still
right.
dope. So, well, well, thanks so much, and good luck to you. And where can people find you?
They can find me, of course, on LinkedIn, Okenna Oparah. I think that's probably the best place for me. My other social media is, whether or not I'm on there is anybody's call. You're right, right.
We'll get you in touch with the social media,
I appreciate
management
it. I'm gonna need a consult.
specialist.
Yeah.
We can amp that up for you. We'll interview one for you and network, connect you guys.
All
But you
right.
do have a website. What is your website?
Oh yes, escapingretail.com. You can definitely check me out there.
escapingretail.com, and we're going to list it below as well, so that everybody has a way of getting in touch with you and staying in contact with what you're doing. So thank you, sir.
Thank you.